vaginal dryness actually can be both. So the PRP, the O-shot, and the Intima technically are both. I kind of go again with what other problems or symptoms that the client wants to treat. And again, with the exam, if I see vaginal atrophy from like the cervix or the vaginal vault, if they don't have a cervix, to the introitus, and it's all atrophied, then the O-shot, although can help, I'm gonna say probably she would need a little bit more of the Intima. But that's like, I can't answer that from the questionnaire. It has to be done from the exam. But again, like the O-shot would still help, but what I would probably recommend would be the Intima. But it really depends of what other symptoms you would want to treat. So if she has lack of sensitivity, then this here technically won't necessarily help, but the O-shot will. But then I did see a client which had a little bit more of the vagina was a little bit more lax, so technically the lack of tone, which if you technically increase the tone, then you would increase a little bit of the sensitivity in itself. So then the laser, the Intima, can help with the tone that the PRP or the O-shot cannot. So a little bit of both usually, and the combination of both really does help. In the end, the client is able to decide what she wants to do with the information that I do give.
And are there any women who cannot have this laser?
So for the laser, there's a little bit more contraindication to the laser compared to the O-shot. Like I had said previously, the O-shot, there's not a lot. Everybody can usually be a candidate for. The laser is more specific. So somebody that had like a previous surgery with a sling with a mesh inside technically would not be a candidate for it. That are on immunosuppressants, so basically the healing is not that great. Then they're not a candidate, but technically they could still have the PRP.
Okay. So what is the healing?
For the healing for the Intima, a little bit more than the PRP. So for the vaginal, if we're just doing vaginal or internal laser, there's not much pain. The only downtime is no sex, no tampons, nothing that goes in the vagina for 7 days. Okay. And what did you say?
No boys, no toys, no tampons.
That's it. For the exterior, again, you're going to feel more like itchiness, more discomfort, just because of the skin that needs to heal on the outside. So I usually say that you're going to need like either Vaseline or coconut oil or Aquaphor or Replens, which is like vaginal moisturizer or any vaginal moisturizer that you can find to soothe those symptoms, and like no baths, no pool, no hot tubs for 7 days. 7 days. And there's none of that with the O-shot. And no soap. Never no soap.
Oh, that's never. You're right. So other than being a little itchy and a little uncomfortable, can I work the next day?
You can definitely work the next day. For the day of, you're going to feel more swollen. The tissue is going to be more swollen, so you're going to have a little bit of ice that you can put on, like 10 minutes on, maybe every hour, just to get it to feel more comfortable. But you can still work that same day.
Oh, that same day?
Yeah.
Oh, wow.
Yeah.